Hi, welcome. I'm Julie Shepard, the founder of First Healthcare Compliance. We provide a comprehensive compliance management solution for healthcare providers around the country. Today, we have with us Weiner Benefits Group. Weiner Benefits Group has a long tradition of serving the insurance and financial needs of individuals and businesses since 1938. Debbie Shears is our presenter today. She is a partner with Weiner Benefits and has over 25 years of experience in the benefits industry. She'll provide us with updates regarding the Affordable Care Act and how it affects employers. Debbie, welcome.
Thank you, Julie. It's great to be here today. And just as a disclaimer, I'm going to be speaking on the Affordable Care Act. The information that you'll be hearing today is current and to date up until today. However, it also is subject to change. As we all know, the Affordable Care Act is definitely constantly changing. Healthcare reform actually was enacted in March of 2010, on March 23rd of 2010, and at that time, significant changes have been made to the healthcare system. This is to be implemented over several years, and it impacts all kinds of people. It impacts providers, government programs, health insurance issuers, employers, and plan sponsors, as well as individuals. And most employers will be impacted in some way. We're going to start out talking about an exchange. And what is an exchange? There is a public health exchange, and I'm sure that y'all have heard more and more about this as time goes by. It's primarily a marketplace for purchasing health insurance and it offers qualified health plans. It can be run by state or the federal government with consumer assistance from other entities. And it's offered to individuals and small employers, currently up to 50 employees, but that is subject to change in 2016. Qualified health plans include plans that are offered by an approved insurer. They have to be certified to meet the exchange requirements. They must offer essential health benefits, and that is specific to either the federal government or the state. There are 3 different types of exchanges, and I'll go over that in just a few minutes. They must meet cost-sharing limitations, and they must be priced exactly the same as plans outside of the exchange. There are 4 different levels. There's bronze is the lowest, which is at 60% actuarial benefit. Silver is a 70% actuarial benefit. Gold offers 80% actuarial benefit, and platinum is the plan that offers a 90% actuarial benefit. There's also a catastrophic plan for young individuals who are under the age of 30. To be eligible for the exchange as an individual, you must be a citizen or a legal resident, you can't be incarcerated, and you must reside in the state covered by the exchange. And like I said, there are separate subsidy eligibility rules as well. A small employer is up to 50 employees at this time, a company that has 50 or fewer employees. And they can also shop in what's called the Small Group Health Options Program. That is for small employers only, and it must be offering qualified health plans to at least all of your full-time employees. And the shop is used primarily in either the office location or the employee's primary worksite location. Most individuals can shop for exchange coverage even if they're eligible for employer coverage. So if you are eligible for employer coverage, you can still go out to the exchange and look at what other options may be available as long as it's during the exchange open enrollment. The SHOP program is offered to employees all throughout the year. So whenever your plan comes up for renewal at open enrollment, if you have less than 50 employees, up to 50 employees, you can offer your plans through the SHOP program, the Small Group Health Options Program. It should be offered through a cafeteria or a Section 125 plan, and the exchange actually sets the contribution method. So it can be a defined contribution with either a set amount or a set defined percentage that's paid for by the employer. In 2016, however, states must increase the size of the small employee offering up to 100 employees. And then in 2017, as it stands right now, any size employer can participate in the SHOP program. This is just a map showing the different types of insurance exchange programs that are available. The federal government requires that every state offer an exchange. There are some states that do offer their own state exchange, and those are the ones in red. They have declared that they would put in the effort and create their own state-based exchange. There are some states that decided to offer a partnership exchange where they partnered with the federal government, so they use the federal government website. However, the essential benefits are chosen by the state. And then for those states who did not want to either partner or create their own exchange, they would default to the federal exchange. And you can see that's the majority of the states are a part of the federal exchange. Now, who can shop for coverage inside of an exchange? There are subsidies that are available for individuals, low-income individuals who are between 100 and 400% of the federal poverty level. Now, they cannot be eligible for government programs that provide coverage, such as Medicare and Medicaid. However, if they're between that 100 and 400%, they could be eligible for not only premium help, but also cost sharing help, which means that the cost sharing can be reduced. So if you have a plan that's maybe a $3,000 deductible, the deductible could be reduced if your income is less than 250% of the federal poverty level. So between that 100 and 250%, you could also be eligible for cost sharing. It's not available for individuals who are eligible for affordable minimum value employer coverage, or if you are enrolled in an employer health plan, you cannot receive a subsidy. So even though you can go out to the exchange at open enrollment for the exchange and possibly apply for coverage, you cannot be qualified for a subsidy if you are eligible for affordable and minimum value coverage through your employer. When is the exchange enrollment? It is actually every year between November 15th and February 15th is the annual open enrollment. And selections must be made by December the 15th for January 1st effective date. Now, throughout the year, there are also special enrollment qualifying events. So, for instance, if you lose your employer qualified coverage, that is a qualifying event to go onto the exchange within 60 days of losing the coverage through your employer. Also, birth of a child, marriage, those are qualifying events as well. Now, in 2015, there was actually a special enrollment period for those individuals who did not understand that they would receive a penalty if they didn't have health insurance until they filed their taxes this year. And when they filed their taxes, all of a sudden they realized they were going to have to pay a penalty. So for those individuals, there was a special enrollment period that actually will close the 30th of this month, on April 30th. Small employers can buy coverage for employees anytime during the year because that's going to be when they actually have open enrollment. The plans do have to be a 12-month plan year, and annual election periods will apply. And again, there are special enrollment periods for employees with qualifying events like birth of a child, marriage, those divorce. Those are all things that are qualifying events for special enrollment periods. The timeline for SHOP employers, again, it's a 12-month period. It begins with the effective date of coverage. The employer will receive notice 90 days before the end of the plan year, and they have 30 days to change the SHOP plan. And then, however, the plan will continue if no changes are made. Now, an employee must have 30 days to make their elections. So if you are considering looking at the SHOP this year, it is available online this year. Employers under 50 employees do have the option to offer this. However, you need to apply for the SHOP, and then you also have to do this within 60 days so that your employees have 30 days to make the election. For instance, if you are a July 1st renewal this year, you have to make your decision by May 1st of this year if you're going to offer coverage through the SHOP so that your employees have the 30-day window to make their elections. What information do you have to give your employees regarding the exchange? Back in October of 2013 was the deadline to begin offering or begin to present to your employees the notice of the exchange. Now, when this initially was explained or was given to, was told to be given to the employees, it was mandatory. However, that was released. It is no longer mandatory. It is, however, highly recommended to be offered or be given to all of your employees. And this is no matter what size company you have. So all size companies should give this notice of exchange to all of your employees. If you haven't done it, you can still do that. You just need to go ahead and do it. For new hires, you have 2 weeks to give this notice of exchange to new hires. And there are model notices available. The delivering the notice, it can be done by first-class mail, must be provided in writing. However, it can be provided electronically if the Department of Labor requirements are met. Now here we go talking about the fees. What fees do we have to pay under healthcare reform? I'm just going to go over just a few of them. The Patient-Centered Outcome Research Institute fee, PCORI fee. This is a fee to fund research on informed health decisions. It's paid by issuers as well as self-funded plan sponsors. And this also includes self-funded plans, including HRAs. So if you have a high deductible health plan as an employer and you're offering an HRA alongside of the high deductible health plan, that is actually considered a self-funded plan for most people. And you will be required to pay the PCORI fee on those HRA participants. Every year by July 31st, there is a form, it's the Form 720, IRS Form 720, that has to be submitted by July 31st along with payment. And this is for plan years beginning on or after October the 1st of 2012. And it will end with the 2018 plan year. At least that's the way it is right now. The cost is increasing. It's not a whole lot. It started out in 2012 at $1 times the average number of covered lives. In 2013, it increased to $2, and in 2014 and beyond, it's based on the national health expenditures. For 2015, the fee is $2.08 per average covered lives, and this includes dependents. So it's not just the employees covered on the plan, it's the dependents as well that are covered under your plan. There's also reinsurance fees. This is a fee to fund a reinsurance program that helps to stabilize the individual insurance market. The reason for this is because individuals a while ago used to have to fill out a medical history questionnaire, and they could be declined coverage if they had any serious medical conditions. As of January 1st, 2014, that is no longer the case. And everyone is eligible for health insurance, whether they have a pre-existing condition or not. There are no more pre-existing conditions as well. So the reinsurance fee is actually a fee that is included in employers' fees. So it's employer in the small and large group market as well as self-funded employers. And this is to cover the reinsurance program for the individual market. This is supposed to be a 3-year window, and it runs from 2014 through 2016. Fees are based on the annual national contribution rate, and in 2015, that's $3.67 per month, or $44 per year times the average number of covered lives. And again, this is including dependents. So it's $44 per year times the average number of lives. So you have 44 plus the $2.08 PCORI fee. That's $46.08 per person covered under the plan. If you are in the fully insured market, these rates are included in your premiums, so you don't have to pay anything additional. However, if you have a self-funded plan, then you will have to pay this additionally to the government. And you will have to report on November 15th. By November 15th, you will have to submit the enrollment count to the Department of Health and Human Services. by December 15th, they will notify the issuer of the amount that is due, and then the payment is due within 30 days. Then there is a health insurance provider fee. This was effective in 2014, and it's actually due by September 30th of each year. It's allocated according to market share, and in 2014, the amount that the health insurers had to pay was $8 billion, and that's nationally. And it's going to be increasing to $14.3 billion in 2018, and then based on premium growth in later years. This applies to all health insurers. So any health insurer that is in that offers fully insured plans, these are included in your premiums. If you are in the self-funded, as our self-funded employer, you will not have to pay these in addition to your premium. The self-funded is given by, as you can see, companies with 25 million or less in net premiums, self-insured employers, government and nonprofit entities, and VEBAs do not have to pay the health insurance provider fee. Do I have to offer coverage to my employees? This is the part we're going to talk about the employer shared responsibility rules. You may have heard them called pay or play. If you have 50 or fewer if you're a small employer with 50 or fewer employees, you do not have to offer health coverage. You're not required. However, you also can get tax credits. A few minutes ago, I talked about the SHOP program. If you are a small employer with 25 or fewer employees, you can actually possibly qualify for a tax credit. If you have 25 or fewer employees and you pay 50% or more toward the cost of the premium, and the average income for your full-time employees, not including owners, is $50,000 or less, it's possible you may qualify for a tax credit for up to 2 years that will help pay toward the cost of the health insurance premiums. If you are a large employer with 50 or more full-time or full-time equivalent employees, you are required to offer coverage to your full-time employees and dependents in order to avoid those penalties. Coverage must be affordable and provide minimum value. Penalties were delayed until 2015, so we are now in full swing of the penalties, which will be actually applied in 2016 for the 2015 tax year. Employers with between 50 and 99 full-time employees may be eligible for an additional year and before they have to submit their penalties. Employer penalties can be triggered if any full-time employee receives a subsidized coverage on any exchange. Pay or play guidance. So this is where it started. In January of 2013, there was proposed pay or play regulations issued. In July of 2013, the effective date for the penalties and reporting was delayed until January 1st of 2015. In September of 2013, proposed reporting regulations were issued. In February of 2014, the final pay or play regulations were issued. And then in March of 2014, the final reporting regulations were issued. And we'll get into that in just a few minutes. There is a transition relief for the smaller, applicable large employers, which is between the 50 and 99 employer group. There's a 1-year delay that they're considered medium-sized business, and it's to help the smaller employers to transition into providing affordable minimum value coverage. No penalties will apply during the transition period as long as you qualify for Section 4980H, A, or B, which applies to all of 2015. For non-calendar year plans, it includes a portion of 2015 that will also go into 2016. This applies to applicable large employers with fewer than 100 full-time employees, including full-time equivalents on business days during 2014 that meet the eligibility conditions. The eligibility conditions for the transition relief include, this is for employers that change plans after February 9th of 2014 to begin on a later date, they are not eligible for the delay. So if you are a small employer with 50 to 99 employees, and you changed your plan year between February 9th of 2014 and the end of the year, you are not eligible for the delay. If you reduced your workforce reduce the hours of service or completely reduced your workforce between February 9th and December 31st on 2014, you will not qualify for the transition. However, if the changes were due to bona fide business reasons, then it is permissible. The maintenance of previously offered coverage, employers may not eliminate or materially reduce coverage offered as of February 9th, 2014 during the maintenance coverage period. So if you reduced your employee count or changed or completely eliminated your employee benefits, your health insurance, and you will not qualify for the transition relief, and those penalties will be due this year. You also must certify that you meet all eligibility requirements. And there's a certification form that's included as a part of the final employer reporting requirements that are due at the end of this year. The penalties, there are two different types of penalty. Penalty A is if an employer does not offer coverage to substantially all full-time employees and dependents, and dependents includes children. One thing you, as an employer over 50, can do is you are no longer required to offer coverage to your spouse, to the spouses of employees. If you do that, it certainly is something that's eligible. So the dependents are children, and that's who you would need to offer coverage to, the employer and children. The penalty for not offering any coverage at all is $2,000 times the number of full-time employees minus 30. And the transition relief for 2015 for applicable large employers with 100 or more full-time employees can reduce their full-time employee count by 80 when calculating the penalty. For penalty B, if the employer does offer coverage to substantially all full-time employees and dependents, but not all employees, or if coverage is not considered affordable or does not provide minimum value, then the penalty is $3,000 times each employee who gets a subsidized coverage through the exchange. However, it is capped at the penalty A amount, so it's capped at the $2,000 times the full-time minus the 30. To avoid the penalties, the offer of coverage must be given to all full-time employees and dependents that is affordable. And to be considered affordable, the employee's contribution for self-only coverage does not exceed 9.5% of income. Now, there are safe harbors as to what income and premium amount to use. The safe harbor qualifications are the income can be 9.5% of either W-2 income, rate of pay income, or the federal poverty level. So you could use one of those three in order to determine the 9.5% of income in order to be considered affordable. It also must provide minimum value, and that means that the plan must cover at least 60% of the costs on average. There is a minimum value calculator or design-based checklist. However, if you are offering a bronze level benefit, that is considered minimum value. And we see a lot of employers offering multiple plans so that they meet that minimum value plan to be offered at least minimum value and the 9.5 of the lowest income person in order to not have to pay the penalties. Substantially all full-time employee percentage. The proposed rule is that employers must offer coverage to at least 95% of all full-time employees in order to avoid the largest penalties. However, there is a final rule that's to be phased in over 2 years. So in 2015, employers must offer coverage to 70% of all full-time employees. In 2016 and beyond, that offer must be given to 95% of all full-time employees. Employers can still be exposed to lesser penalties if coverage is not offered to all full-time employees. Now, who is considered a full-time employee? There are two different types of employees. There's a full-time employee and a full-time equivalent employee. The full-time employees, this is counted for determining if you are a large employer. And those full-time employees must be offered coverage along with the dependents in order to avoid penalties. Full-time equivalent employees are those variable hour or part-time employees that are counted as a fraction for large employer determination. So for instance, if you have 40 full-time employees and say 20 or more part-time employees, you can actually be considered a full-time employee if those part-time hours equate to take the additional 10 employees to take you up over 50. But they do not qualify. You don't have to offer them benefits, but it would qualify you for the large employer market, which is where the penalties would come into play. Seasonal employees, there's a special rule which applies to large employer determination when you have a lot of seasonal employees, and that is for an employee who works 120 days or fewer. They were considered seasonal employees, and they do not have to be considered in the variable hour employee count. A full-time employee with respect to a calendar month is an employee who's employed on average at least 30 hours of service per week, or 130 hours of service in a calendar month, which is the equivalent of 30 hours of service per week for a full-time employee. Full-time equivalent employees. Now this is your part-time and variable hour employee count. You would need to add the number of hours of service in a month for part-time or variable hour employees up to 120. So you're going to take the number of hours that they work and divide the number of hours by 120, and the result will give you the number of full-time employees for that month. And you take that number and you add to the number that you to determine if you're going to be going over the 50. Now, for those employers who do have a lot of variable hour or part-time employees, there are different measuring periods, and this does get complicated. And it actually started, you should have started counting those hours in 2014 if you were in an off-calendar year, but in 2013 if you have a calendar year plan. So there's 3 different types of measurement periods. There's a standard measurement period, and then there is an administrative period and a stability period. And there's different rules for, these rules protect full-time employees from transferring in and out of the positions. There's 2 different types. There is a look-back measurement period and a monthly measurement period. Now we see most companies using the look-back measurement period simply because that seems to be the easiest to calculate. So if you have a measurement period of the look-back measurement period, you can use anywhere from 3 to 12 months as your standard measurement period, and this should have been started last year. We're seeing, if you ever are an employer with a lot of people who, a lot of transition in and out of employment, you probably will want to use the 12-month measurement period so that you're not constantly having to offer coverage. It makes it a little bit easier to track the employees. So you would track them for 12 months, and then you have up to 90 days which is the administrative period for enrollment or disenrollment from the plan. So you want to bump this up against your benefit period, and then you have that 90 days prior to your benefit period to offer them coverage. Now you also will have a stability period, which is the length of time that you will have to offer them coverage. So if you have been tracking your employees, which you should have been doing, and they have been working an average of 30 hours per month for the past year, and you're coming up on enrollment, then you have that 90 days that you need to offer them coverage, and they would be eligible for 12 months. You have to make the eligibility period the same timeline as the standard measurement period. So they would be offered coverage for 12 months. During that time, their hours, you have to continue to track their hours, and they may go up and down. However, if they go below 30, you still have to continue to keep them on the plan. So you have to continue to keep them on your benefits for the full year unless they leave employment. And that would be the only way that you could take them off the benefit period, the benefits. Now, during that same time, if you have new hires, you also have to continue to track their benefits or their hourly rate. So if you are hiring someone as a part-time or variable hour employee, then you have to start tracking their hours as a new hire, and you would track them for 12 months, and then at the 13th month you would have to offer them benefits. So that tracking period for a new hire runs concurrent with the stability period or the standard measurement period for your current employees. This is a look-back measurement period method for ongoing employees, and this is if you are based on the calendar year benefit period. You would have started the measurement back in November the 1st of 2013, and that runs through November the 30th of 2014. And then you would have, well, November 1st, this is a 60-day period, administrative period. You don't have to take the full 90 days as your administrative period. You can take anywhere from 30 to 90 days as your administrative period to determine the number of employees who will be eligible for benefits. And then those people would have been eligible for benefits on January the 1st of 2015, and they will have to remain on your plan for the full year of 2015 unless they leave employment. And at the same time they're on this plan, you continue to track their hours. Because next year, when it comes up for the enrollment period, if during this stability period they did not work a minimum of 30 hours average for the year, then they will not be offered coverage the following year. The waiting periods that are implemented, the longest waiting period that an employer can have to offer benefits is 90 days. That started with the 2014 plan year. First of the month following 90 days is no longer permitted. However, the Department of Labor does recommend or allow shorter periods if you want to use first of the month for enrollment. First of the month following 30 days is definitely allowed. First of the month following 60, it depends on the carrier. Some carriers will allow first of the month following 60, but everyone will allow first of the month following 30 days for initial eligibility. For variable hour employees, the measurement hours up to 12 months to determine the full-time status. And then for new hires, they must be offered coverage by the end of the 13th month. So you're tracking current employees who are not full-time, who are variable hour or part-time employees. You continue to track them during the stability period. And at the same time, you're tracking new hires so that you can offer them benefits at the end of 12 months. And you have, by the 13th month, they must be offered benefits. Also, if you are a large employer, you're subject to 6055 and 6056 reporting requirements. If you are an applicable large employer that offers a self-insured plan, then you must complete Forms 1094C and both sections of 1095C. Now, the 1095C must be given out to every single employee. That will include the employer's name, tax ID number. It will also include the individual's name, address, the type of coverage that they have. You need to make sure that you put on there the lowest plan, the minimum value that's available, as well as the cost must be affordable. So that needs to be put on the form. And that has to be given out to every single employee by the 31st of January. So it's like a W-2. It has to be given out to every employee at the same time as your W-2s. Now, in addition to giving the information to the employee, and if you are a self-funded employer, you also must report all that information on the dependents on that form as well. You also need to report Form 1094C to the IRS, and that will include all of the 1095C forms that you've given to each of the employees. So you give them to the employees. You also have to provide them to the IRS. And the 1094C is a transmittal. That is also where you certify that that your plan is affordable and of minimum value. So those are the forms that need to be submitted to the IRS. If you submit those forms by paper, they have to be submitted by February 28th of 2016. If you submit electronically, you have until the 31st of March to submit all of those forms to the IRS. If you are an applicable large employer that sponsors an insured plan, so if you're fully insured, not a self-insured, then you also are subject to providing these 1095C forms to each employee. You just don't have quite as much information to have to report. You will also have to provide the transmittal along with all of those forms to the IRS in the same timeline as if you were self-insured. For non-applicable employers who offer self-funded plans, this is for those small employers under 50 employees who are now offering self-funded plans to their employees. Since the Affordable Care Act has come into play, a lot of the third-party administrators and the carriers are now offering self-insured plans down to 25 and sometimes lower employees. So if you're an employer with fewer than 50 employees and you are offering a self-funded plan to your employees, you will be subject to providing these 1095B forms to the employee. There's not as much reporting that you have to provide. It's mainly just the employee's name and social security number, date of birth, providing that you're offering coverage that's affordable. It's a month by month for all of these forms. So if the employee doesn't work for, they're a new hire and they only come on in let's say June, you have a different code that'll have to go into the blocks until they actually are offered coverage. If they are in that transition where they're waiting for coverage to be offered, there's a code that you would put in for those employees. So there are different codes that you will have to report on all of these forms. I know that there are some payroll companies that are offering this service. There are also some accountants that are offering this service. I would definitely speak to someone who can help you or speak with a broker that can help you. These are going to be required in 2016 and it's for all employees. If you are a non-applicable employer, a non-applicable large employer, so if you have less or fewer than 50 employees and you're in a fully insured plan, then you are not required to offer these or to provide these 6055 and 6056 forms to the employer. That will be handled by the insurance carrier. So only companies with 50 or more employees or the full-time equivalents, which would take you up to over the 50 employees, including your part-time and variable hour employees. So if you have, that takes you over the 50 mark, then you are subject to these 6055 and 6056 reporting with the 1094 and 1095 forms to be given to the employees and the IRS. However, the carriers will provide these forms to employees if you have fewer than 50 employees and you're not offering a self-insured plan. Okay, that concludes my presentation for today, and this is our contact information on the screen. This is a general mailbox, the group service at gweiner.com. If you have any questions and you would like to ask us questions, please feel free to contact us.
Thank you, Debbie. That was a really valuable update, and I'm sure everybody enjoyed that. Again, thanks for joining us today. If you have any questions for us at First Healthcare Compliance, You can reach us at 888-54-FIRST or 888-543-4778. Thanks.